This conference will now be
Well, good morning. This is Matt Schwartz. I'm chair of the Worksite Wellness Council of Louisville, and we are excited to have you here with us for the next in our series of virtual wellness conversations. It's November of 2020. We're all kind of excited that it's almost January of 21 because 2020 will be behind us. With that said, we're fortunate this morning to have a couple of folks from the Wayne Corporation. So it's actually based here in Louisville, but they are actually a mental health provider. They're an EAP company based here in Louisville. And they provide programs to employers and mental health support for employers and employees. So we have with us first, and who will lead off the presentation is going to be Derek Wilhelmus. And he's actually currently the CEO. He's been CEO for Wayne Corp for 5 years, and he's, I think, going to endeavor to give us an overview of the world of stress management and how EAP can fit into that. And so we're happy to have Derek here. And then Tony Hall is going to join us. He's a licensed clinical social worker, and he's actually, out in the field, so to speak, works with a lot of employers. Been doing that for 14 years. Let's see, he's not only a licensed clinical social worker, he's a substance abuse professional, certified employee behavioral certified employee assistance professional. So, again, he's out in the field working with employers and employees. So with that, we've already given control to Derek with the screen. So Derek, lead us off, and thanks for joining us.
Absolutely, and good morning to everyone, and really appreciate the opportunity for a few minutes with everyone. We'll probably be 30 to 45 minutes at the most, but as we go through some of these topics, feel free to a lot of times just send questions through chat, and we'll try to answer them as we go, or we can just kind of do a live Q&A at the end, whatever's that works best for everyone here. I will give a little bit of a State of the Union, as you can see on your screen, about EAP and workplace mental health, and it's not going to be necessarily here's what an EAP is, because I think a lot of folks on this call already know that, but more kind of what we're seeing right now, more what's going on as we speak right now. So after that, I'll hand it off to Tony, and he's going to give you more of a clinical kind of deep dive on what we're seeing right now, as well as some stress management techniques and life balance and some really kind of interesting things I think you'll find value in that you can either individually or you can take back to your organization. And these are really things that we're kind of doing every day in our world, but we realize that not everybody else is. So we can hopefully share some value with you this morning. Like I said, I'm not going to spend a lot of time on what an EAP is, but anytime we talk about mental health in the workplace, I think it's important to make the connection to EAP because that's kind of the backbone of what it is. A traditional EAP, as most of you folks know, right, it's a benefit we integrate into a company's benefit plan. It's going to allow for employees, folks in their house, to get some free counseling. Obviously pretty important right now, especially in our climate. There's a lot of other things that go along with it, and that's probably for a presentation on another day. But folks like Tony, who will speak later, would be an account manager that would do things like supervisor training and on-site type situations. In this case, we're doing a lot of Zoom, as well as any type of sticky situations that occur with employees. We can really assist with and consult on those kind of things. So it's a very nice, a very generous benefit for employers to give to their employees, and there's some benefits for the employers as well. And you can see on that chart on your screen, having a healthy workforce, both physically and mentally, can really help your, not just the health of your employees, but your business, health of your business. And there's some items there: reduced healthcare costs, increased productivity. Another word we hear sometimes is presenteeism, if you're all familiar with that word. So actually, not necessarily just being there, but just being there and being productive. Right? Big difference, as we all know. So that's kind of the, again, EAPs being the backbone of your mental health in your workplace. And I'd like to share a little bit of kind of what we're hearing now that we're in kind of amidst a pandemic, as you guys well know. And it seems to be that it's going to be going on here for a bit longer. So here's what we're hearing, and this is probably going back to March. We've really seen kind of what I'm calling it a flip of the industry, if you were. And I'll explain what I mean by that. Traditionally, mental health services have been delivered, I would say, and Tony, you can correct me, but the large majority face-to-face. You know, maybe not in our portfolio, I would say probably 90% face-to-face, 10% telehealth and telephonic. As of March 12th, I think it was, we went in less than a day overnight, we went to say 99.9999% telehealth. And we're continuing to do that as well. And I'm giving you personal kind of feedback from what our company's doing, but I can tell you that it's probably pretty, generally speaking, it's probably going to be consistent across other communities, other parts of the country as well. There are people doing face-to-face counseling, certainly. A lot of times that's kind of based off the clinical need. So those would tend to be very high kind of need cases, could be substance abuse or like a severe mental health type breakdown, things like that. So the feedback has been overwhelmingly positive from our folks that are accessing our program. And we've really tried to keep our finger on the pulse of that. We have a lot of internal meetings just checking in. What are you hearing? Because things have changed so drastically. What are you hearing? And the feedback has been overwhelmingly positive that I'm very appreciative of the fact that I can still use this program. Not only that, the access of this program is pretty easy, kind of saving on some commute time. And we've had nurses do calls and during their lunch break, things like that. So the ease of access has kind of changed a little bit. And I think this is going to not just be temporary with the pandemic. I think as the pandemic is in our rearview mirror, I believe that we'll continue to see that. I do think we'll get some face-to-face going back, but it could be a 50-50. I think it's hard to predict right now, but I really think that our industry has changed because of that. And I think it's changed for the positive, especially for the utilizer of the services. Now, that being said, the change has created also quite a stress on the mental health system. And when I say mental health system, I don't just mean EAPs and here in our particular world, just across our whole community. And I can speak to Louisville as well. I mean, people are utilizing more services, and not just that, when they're utilizing them, their issues are a little more severe. So they're using them more frequently or for a longer time, I should say. What that has done is made it difficult for some folks to get in. So we're seeing longer lead times in the community to be able to just get maybe your first appointment, or people not taking new patients, things like that. Again, this is an opportunity to really lean on your EAP if your organization has one, because they should have the infrastructure already set up to help you with that. I can, again, personally speaking, from our company's standpoint, we can get a person in 4 business days. And we really work hard to keep that as best we can, keep within that time range. So it probably goes without saying, but our folks, our mental health professionals, they're on the front line now on the mental health side, and it's going to continue even once we've kind of gotten through the pandemic and we have the vaccinations are out and people were starting to kind of see that this thing is in the past. Evidence shows that it's going to continue to be kind of a frontline type situation on the mental health side, because these aren't going to be things that kind of go away just with 30 days or 60 days. It's going to be a long-lasting impact. I'm going to flip to the next slide here. There we go. So just a few other things that I will mention as far as EAP goes, and the importance of having confidence in your EAP and why it's critical, especially during these times. People are using it more. I've mentioned that before. So higher utilization. So the ability to kind of have less red tape, less authorizations, and not be kind of connected to health insurance in this case, I think is getting people to use the program more frequently. We certainly are seeing that. I know our counselors are stressed to the max with utilization. So and that's a positive thing, and that's what we want. Let me just make sure I don't want to read everything to you guys. I want to make sure I don't miss anything as well. So the other thing that we're seeing is because it's been talked about on such a national, regional, statewide, and Louisville level, mental health, that stigma of mental health is improving. Traditionally, EAPs, national average, people use it 4%, 5%. In an EAP like ourselves, that maybe hangs our hat a little bit more on personal service, we expect to get a higher utilization than that. So the fact that it's being talked about on many levels, and on the employer level, I think is a great thing because people are using it more. We're seeing more people access it, both for small and larger issues. A lot of these small issues, and Tony will probably talk about some of that, are becoming more profoundly severe, I think, because of this. And we've even experienced additional trauma and in our own community here in Louisville, as you guys know, with social unrest, pandemic, and quite a few things going on. So all those things have affected kind of our world, if you were, and in turn, you guys. Tony, I don't know if there's anything I've missed on this before I hand it off. You're welcome to speak up.
I would chime in and say, in relationship to the adjustment of clients to their use of Zoom, from a clinical standpoint, I've seen a lot of benefits to it. It's been beneficial in that I think people, in a therapeutic process, one of the things that we try to do is to help the person take off the social mask, if you will, that everybody tends to wear, to become more authentic and more genuine. And the fact that they're able to sit in their own home, the comfort of their own home, sometimes in their bedroom, sometimes in the living room, wherever they may be, to start the therapeutic process really aids in them being able to get to their core, genuine, transparent self. I think that it's kind of expedited. So the building of rapport that occurs in the first parts of the therapeutic relationship. That's what I've seen. So it's been extremely beneficial, even from a clinical standpoint. I will say the thing we do struggle with as clinicians is kids under probably the age of about 10. It's much more difficult to try to build rapport with them, obviously, because typically you sit down with them and you play games and things like that. So the technology is a little bit of a barrier with kids under the age of 10. But outside of that, it's been surprisingly more positive than I think I ever would have imagined. Yeah.
Thank you. And we just encourage, before I hand it off full time to Tony here, we encourage you folks, lean on your EAP, and as employers, be flexible and understanding with your employees to utilize these services, because they're as important now as they've ever been with what's going on. So, Tony, I will hand it to you. I will guide for you as well.
Sure. It's nice to be here. Thank you all very much for the invitation. I want to talk about stress management. That's what you asked for, which we're going to transition into what's known as resiliency in a little bit. But first, I want to give us context. I want to give us an overview about what we're all, because we're all going through this, we're all swimming in the waters, what we're all experiencing, what's impacting all of us. Then we'll shift into how to manage and cope with this. So what's happening? Next slide, Derek.
Yes,
so what's happening is that we're all experiencing two things. We're all experiencing trauma, and then the next thing that we're experiencing is grief. Trauma, next slide, Derek. Trauma is two things. In our world, we categorize trauma as big T traumas or small t traumas. So a big T trauma is something that's a single event that's short in duration and is explainable, like a car accident or a tornado. So that it's explainable in that it was a wet road and the car slid off, and it's short in duration. It's over now. Small T traumas are more cumulative and they collect. So a small T trauma, and they're more difficult to explain. A small T trauma might be, why did Dad leave when I was 6? Did he really love me? Am I worthwhile? Small T traumas are also the things that we're starting to experience now, which is accumulation of a multitude of lots of little losses that we're all experiencing. Next slide. So the things that we're experiencing through these losses are loss of being able to go out to dinner when we want, loss of being able to go to sporting events, grief and loss around not being able to watch our kids attend graduation in person, financial concerns about whether we've got our job or whether we don't have our job, and we could go on and on and on. So all these little traumas accumulate up to a large feeling of anxiety that we're starting to feel and grief that we're going through. I also want to say, can you back up just a second? I also want to say that, and this isn't a political statement, this is more a psychological dynamic that's happening, is that if you've got a child and they come to their parents and they say, I've been abused, then if those parents say, oh my goodness gracious, we are so sorry, we're going to take care of this, we believe you, who did this, etc., and they start going down the process to support that child, that's much different than if the child goes to the parents and say, I've been abused, and one of the parents says, oh my goodness, I believe you, and the other parent says, I think this is a hoax. I don't really believe you. And then the two parents start to fight over the situation that's going on. So that's what's happening with the information flow in our government. Through no fault of our own, not picking sides, just saying from a psychological standpoint that what's happening is also a trauma. The information pandemic, if you will, and the inconsistency of what to believe is additionally creating trauma to all of us while we're also going through a trauma. So I wanted to point that out because it's extremely important given the context of what's going on and what we're going through. Okay, so the next slide. And then the next slide. Okay, so lots of small traumas flip into grief so that we all are going through the grief cycle. And it would sound something like this. Denial is the first phase. So if we were just sticking with COVID, the denial is it's a hoax. The denial is, why do I need to wear this mask? This is silly. The denial is, okay, maybe why can't I just go to the party? I'm going to go to the party, even though the governor they say that I shouldn't go to this party. I'm going to go to the bars. I'm going to go to the party because this is all just ridiculous, or it's not going to hurt me. Well, this is the best one I've heard so far. If I was going to get COVID, I would have gotten it already. So that's denial. Then there's a shift into anger, which we're all feeling, which is like, oh my gosh, and you can see it play out on Facebook and everywhere else, which is the anger of at the governor, or the anger at, you name it, each other, because you go to Walmart and one person's wearing the mask and then somebody else isn't wearing a mask and you're frustrated the person's wearing the mask. And the person that thinks this is just a hoax is frustrated the person that really is wearing the mask. So it plays out in the social dynamic that we're seeing today, this anger. Bargaining is when we start to say, you know what, I don't want to wear this mask, but it may help. I do really want to go to the football game, but it may help if I can understand why they're starting to cancel them. So there's this transition that starts to happen, a negotiation that starts to happen, which is you're willing to start to give up some things for the betterment of everybody and yourself. I don't like the word depression, which is the next phase. I think it should start with sadness or frustration, and then depression is after you've been in it for a long time and your coping mechanisms aren't working. But it is the next phase is sadness, and we're all experiencing that too. And then you shift into acceptance. Like, well, it is what it is. It looks like it's going to stick around for a while, and I guess I need to adjust to it. So after acceptance becomes the adjustment of, all right, so what do I need to do to start to kind of take a hold of this and start to rebalance my life in a way that's conducive to what I'm going through and to protect myself and everybody else from COVID. So those that in a brief kind of overview, that's what we're going through. So the next slide. So then it becomes, so how is what we're going through affecting us overall? And this is from the Census Bureau. They put out a household pulse survey to study the effects of what's happening in the country with stress and depression. They do this every year, so it's consistent, so we can look back over time and see what it was compared to what it is now. And it gives us a good snapshot of what's occurring. And this represents about 93,000 Americans that reported back on this study. Next slide. So they asked the question, not being able to stop control of worrying at least several days in the past week, and 53% of Americans said they can't do that, said that they're not able to stop control of worrying. That's a big number. Feeling down, depressed, or hopeless for several days in the previous week, 48%. Having little interest or pleasure in doing things during several days in the past weeks, 19%. So according to these statistics, 50% of us on this call right now are having a difficult time controlling our worry in the past several days. That's over half of us. It's impacting us a lot. How it compares to past data, you're going to see each year the answer to that question, and then this year, 54%. So this time last year, it was only 19% of people had a difficult time with anxiety and controlling their worry. Now it's 54%. That's how much it's impacting us. What's it doing to relationships? What we're seeing, and even through the EAP, I'm seeing a huge jump in doing marital counseling. So there's been a 34% increase in people seeking divorces than this time last year. So it was through March through June, and then they looked at the numbers from March through June of this quarter, and it's been a 34% increase. It's interesting, newlyweds are getting hit the hardest. So 20% of the couples that were seeking divorces in this past quarter were newlyweds, compared to 11% the quarter of 2019, which is real interesting. Substance use, as you well would expect, is going up. 13% of adults reported they're either starting to drink, so new use, or they're increasing their drinking as a way to manage stress. I think that on the backside of this, that's when we're going to see the largest number of people that have problems, because I don't think people are necessarily coming to us yet, although we're definitely seeing an increase, because I think they're still in the process of using it to cope with what they're going through. Once we get through this, then they'll look at it and say, well, I was trying to slow down, but I haven't been able to slow down yet. So I think on the backside of this, we're going to see an even higher influx of people coming in trying to get help with their substance use. And then overdoses are up over 3% since 2019. Gender differences, I wanted to highlight this. So the question of feeling down, depressed, or hopeless. Men reported, were 44.6% of men reported answering yes to that question. Women were 52. Likewise, with the anxiety question, 53% of men, 65. So you could look at this and say, why the discrepancy? And maybe that's because men are stronger, right? Men are handling and coping with this issue better. My experience, and probably some of your all's as well, is that's not accurate. What it is accurate is men tend to want to be the protector and to not really be true and authentic to their feelings. So I want to highlight this for you all to know that I think that we all need to give men particular attention. So when you ask them, hey, how you doing? And they say, oh, fine, we're good, let's move on. You want to say, no, how are you doing? How are you doing? So you don't want to let that roll. You really want to try to hunker down with them and see what you can do to really connect with them to get them really talking. Okay. Next slide. Okay, now, so what can we do now that we understand that we're going through trauma and we're all going through a lot of grief? How do we manage this? How do we manage stress? So I want to shift it to the idea of resiliency, because at the core of stress management is having a balanced life overall, which increases your sense of resiliency to be able to handle stress. And what resiliency is if you've got a straw and you get under stress, if you get put under stress and you don't have flexibility in your life, then you start to break. So if you build in stress in your life, stress management skills and life balance in your life, then you can bend, and then you can bend back so that you're not going to break. You have malleability and flexibility. So that's what we're talking about. The idea of what we're going through and looking at what we can control and what we can't is important because we can't control what's happening around us. And the feelings that we're having are normal feelings that they're okay to feel. So this is very much a situation where it's okay to be not okay. We have people that are called in sometimes, and that's part of the thing that they're struggling with, is that they've determined that something's wrong with them because they're feeling incredibly anxious, which doubles up kind of the problem that they're having. So we start with just normalizing the fact that we're all feeling pretty stressed out. Remember the 54%? So it's okay to not be okay, and that you're not alone, and that you're not broken because you're struggling. Then it becomes, how do you better manage what's hitting you? And the way you manage it is looking at how do you have a balanced life. And I've listed here a list of the categories that you would want to evaluate for yourself, and we evaluate to determine whether you have a balanced life or whether you don't, or where your growth opportunities are. And I want to encourage you, I want to invite each one of you all to write each one of these categories down real quickly on a piece of paper, because I want to ask you to do a little something with it at the end of this training, so that you'll have something that you can individualize and personalize for yourself and take home and start to work on. But I'm going to go through about the first 3 or 4 to be able to kind of talk a little bit about them in more in depth, so that you can get a thicker understanding of, if you're struggling in these particular areas, what you can do to start to increase your resiliency in these areas. And I'll have this list at the end of the slides as well, so that if you don't get everything written down right now, you can catch up on the other side. Okay, so emotional. So when we're talking about emotional self-care, what we're talking about is how you're going to start to take control of what's inside your body, what's inside your feelings. And the first fundamental thing that you do is you've got to start to schedule things for yourself. You got to start to write them down. Anytime somebody's going through a trauma, they feel like they're out of control because they can't control what's coming at them. We can't really control when this virus is going to go away. But what we can do is control our schedule on a daily basis. We can decide, hey, I'm going to start walking, and I'm going to walk at 9 in the morning to 9:30, and then I'm going to get up. I'm going to get up at 8. I'm going to take a shower. Then I'm going to take a walk. Then I'm going to go and I'm going to get in front of my computer and I'm going to start to work. So this is really important for people that are working from home, because their schedule in many cases just can kind of been blasted wide open, that they regain a sense of control by starting to schedule what they need to do on a daily basis. And you've got to plug in time for self-care in your schedule, because otherwise life is going to start to manage you as opposed to you managing life. And if you set a small goal and then you accomplish that goal, then it's going to start to reduce your anxiety, and it's going to start to increase your self-esteem. And it's much better to set a small goal that's attainable than to set a large goal that you're never really going to get to. Every time I talk to somebody about what do you need to do to increase your physical well-being, and then they'll say, well, I think I should start running marathons. It's like, no, how about let's start with, pick one day a week where you can get out and walk for 15 minutes. And it's like, it seems pretty simple. It seems like it's like, well, how's that going to help? I promise you it's going to help, because you're going to be able to accomplish that one, and then you can start to build on top of it. The next idea, it's called logotherapy. Click again, Derek, on the next. There we go. It's called logotherapy, and this is from a gentleman named Viktor Frankl. And if you don't know who Viktor Frankl is, he wrote a book called Man's Search for Meaning. He is a psychiatrist, and he was put in a concentration camp in World War II. And that's a book about how he survived the concentration camp. It's a powerful book, has a lot to offer. At the core of it is, you find beauty in the small things. You find beauty in the flower. Like this, I can't control all this stuff that's going on around me. I'm frustrated because I can't go out to eat or go to a movie. But what I can do is I can take a walk. I can get in a mindful space, and I can look at how beautiful the world is around me. I can take a walk, and I can decide I'm going to find something so beautiful on my walk that when I go to sleep tonight, I'll be able to remember it. That's what we can control. And that's also regaining a sense of control and reducing your anxiety, is appreciating the small things in your life, which shifts to mindfulness. And mindfulness is a key component to emotional well-being. So next slide. Mindfulness is about staying in the present moment. So a lot of times people generate anxiety for themselves because they're catastrophizing. And catastrophizing is painting a movie in your head about something that hasn't happened in the future, that's going to be terrible for you. But because you're in the present moment creating the movie about what's going to happen in the future, then the feelings derived from the movie you created, you feel in the present moment. What mindfulness does is help anchor you in the present moment so that you don't have to go forward and generate catastrophizing thoughts. Mindfulness is incredibly important. Breathing is helpful. Yoga is connected to mindfulness. Tai Chi is connected to mindfulness. So I would encourage you, as the research has shown, it's arguably the #1 thing that you can do to help reduce anxiety. At the bottom of this slide, I like 2 people that I give resources to all the time, these names. Kristen Neff, it's with a K, selfcompassion.org. She talks a lot about self-compassion as opposed to self-esteem. So it's about loving yourself. The other person is Naomi Goodlett, and she has a lot of mindfulness meditations on her website. They're all free, related to stress management and core concepts about stress reduction. I would encourage you guys to go there and start to try to practice these. And they're only about 10 minutes long, so that they're not very long, but it's gonna pay dividends for you. Next slide. Physical. I want to touch on this. You can go to the next slide again. I want to touch on physical because it always seems so simple, but the research says that it's just imperative that we all walk, that we all get exercise. Here's the study. Duke University did a study where they took mice, and they took a group of mice, and they were sedentary mice, and a group of mice, then they exercised the mice. And then they subjected them to ice cold water, and they measured the stress hormones in their bodies. The ones that that were sedentary, the stress hormones in their bodies were much significantly higher than the ones that did exercise. Because when we're in a fight or flight response, we have cortisol and epinephrine and all these stress hormones that shoot through our bodies, and they stay in our bodies. What they found was that the ones that did exercise, the mice that did exercise, both the stress hormones in their bodies were lower, and then also the stress hormones that spiked when they were subjected to ice cold water didn't spike as high. So that shows that what exercise does is it preps our bodies to be able to manage the stress that's coming at us so that it doesn't spike as high when we're in the moment dealing with it, along with the 2 things that burn off stress hormones in our bodies. The only 2 things: really good sleep and exercise. And I don't know why we're made this way, because I know for me, if I'm stressed out, I don't get good sleep. So it seems like the default is, if you're under a lot of stress, exercise is just critical. So please start putting that in your schedule and doing it, even if it's 15 minutes once a week. Next slide. Social connection. The data showed in the study that we just talked about that people were 22% more likely to have emotional distress, anxiety, etc., if they weren't being connected to someone that they love. So reach out to those people. Phone calls are better than text, but you can text them too. Just let them know that you know that they exist and that you love them. There's some really awesome, cool stuff that's starting to happen on social media with live stream concerts and yoga classes that are online and art classes that are online. So as people accept that this is where we're at, and they start to go through the grief cycle and they get to acceptance and then adjustment, as they start to adjust their new social balance, it really is kind of fun. Some of the stuff that you can find online, conferences, all kinds of stuff. So start to look at going out and reaching out and doing some of that if you're not already. And if loved ones are sort of stuck in isolation, try to help coach them into the opportunities they have online. Relationships. There's a resource called 5lovelanguages.com, and it's a really good resource. Quickly, what we're seeing is that relationships are having to make an adjustment in COVID. What's happening is it was a relationship of doing things together, they would go to movies, and they would go to football games, and they would go to the bar and drink, and so they were a relationship of human doing. And since that was eliminated, they have to become a relationship of being. So people are kind of looking at each other at the house and going, who are you? Who are you? I thought I knew who you were, but you were my partner going out and doing things, but I don't think I know who you are. And for some people, that's a great opportunity, and they really strengthen the relationship. And for other people, it's freaking them out. It's freaking them out. So you have to ultimately redefine what your idea of intimacy is and connectedness is through COVID, and that's a struggle for some people. But it's also a great opportunity for some people to really get to know each other better. So that's all the time I have to say about that. But the lovelanguages.com is a good resource, and it's a tool that we use all the time helping people out. Spirituality, and this is the last one. Spirituality is really important. And by spirituality, you don't have to go to an organized church. You can define whatever spirituality means to you. If it's sitting underneath the tree and connecting with something bigger than yourself, then you do that. But the core question in trying to kind of reduce your stress and manage stress is am I living a life congruent to my values? People that don't live a life congruent to their values, there's a disconnect there, self-generate more stress for themselves. They self-generate more emotional angst and conflict inside themselves. It's really important. And then self-compassion, having compassion for other people and expressing gratitude, I think is one of the core components of spirituality. So trying to see the good in things and the good in people and trying to see the good in yourself is going to keep you in a positive mindset and a positive mind frame. The other piece, people say, why is this happening to me? Why is this? How come this is going on? If God existed, he wouldn't be kind of torturing us or punishing us or putting this burden on us. So they start to question theology a bit for themselves. There's a great book called The Purpose-Driven Life that tackles that question about what we all learn and what we all go through when God puts us through difficult times. But fundamentally, people's anxiety goes down when they have the idea of something bigger than themselves, and that there's a purpose of why they're going through what they're going through. So I'm looking at the time. I know we're running out of time, or we're at the end. So what I want you to do, finish writing those down, and your homework is on a 1 to 10 scale. 10 meaning you feel like you're doing fantastic in this area. You feel like you're doing great, and 1 is not so good. And don't judge yourself, just kind of rank it. So in each one of these categories, I want you to give yourself a 1 to 10. And then after that, step back and look at it and reflect and see which one is the lowest, or the top 2 are the lowest. And then just challenge yourself to ask yourself, what could I do? What goal could I set to increase this area? Just 1 point. If you're at a 4, don't try to increase it to a 10. Just ask yourself, what could I do to move this point from a 4 to a 5? And write at least 2 goals down, put them in your calendar, and start to do it. It's as simple as that. Don't try to make it complicated, but do this exercise. I would also invite you, if you've got a significant other, you do yours, take this to your significant other, have them do theirs, and see if there's a couple areas that are both low in both of your all's life balance, and then work on it together to match up. So the next slide. So it's how will you manage it? You've got to adapt. You've got to accept it, even though you don't like it. Adapt, evaluate your life balance, create your self plan, write on your schedule, and do it. Also, if you have an EAP, obviously, at your work, then connect with them. The EAP is here to help you all in any way we can. And as you all know, EAPs are free and confidential. So I'd like to invite you to connect with your mental health professional that you can in your company. Does anybody have any thoughts or questions?
Like there was just a question came through from Suzanne. Can you confirm, you mentioned that exercise was more important than sleep?
Oh, no. I don't. If I said that, I didn't mean it that way. I think that exercise aids in sleep, but certainly there's a balance that's there. But no. What I think I said, the 2 things that help burn off stress hormones are sleep, good sleep, and exercise. So you want to try to get as much of both of those as you possibly can.
Good question.
Mm-hmm.
Yeah, any other questions, or Matt, if there's anything else?
I actually have one. This is Alex also. I want to say thank you so much to you, Derek and Tony, for coming today. I think this is extremely timely. I very much believe in the EAP. I think it's helped a lot of our employees. I do have a question. So the majority of the people on today are HR professionals, wellness professionals. We see a lot of people struggling right now, obviously. Can you give us some examples of how to talk to an employee and kind of bridge the EAP and how they can, utilize you in a way that's respectful to them?
Yeah, absolutely. And a lot of times it depends on kind of what your relationship is with them and your feelings of self-disclosure. So if you can share, hey, I've been through a hard time in my life. I've used the EAP myself, and it was really helpful to me. And I don't want to pry in what's going on with your business, so to speak. It's not mine. I just want to let you know that it's here for you, and I found it really helpful. And it's a good group of people. Maybe you could think about just calling over there if you're a little nervous and asking them some questions even before you set up an appointment. They're happy to do that too. But just, do the best, reach out, and it's okay. We're all going through some tough times. And if you're going through some tough times, then by all means, please use this service, and stress that it's confidential. The company has no idea if you call or if you don't, and they won't know what the heck is going on with you, when you go in and you talk with them. We get no information about who uses the service.
Yeah, and you can even, if it seems to be an issue, confidentiality, you can mention HIPAA as well, that it's protected just like your, physical health records are.
So try to normalize it for them and use some self-disclosure and destigmatize it.
Thank you.
Sure.
There was a question, and Matt, you can tell us to slow down if you need to, of course. Suzanne posted a question about finding our employees are not utilizing the EAP. Is there a taboo around this? How do you get an employee to buy in? And I think some of that plays off of what Alex had just mentioned. And it is, we see a couple of things. Now, national averages, I mentioned before, about 4 to 6%. So, realistically speaking, you're never going to get 50% of your population to use an EAP. They're getting help. And Tony, you may have a newer stat than I do. Traditionally, we saw at any given point, gosh, it could be higher now, 20% of folks could benefit from from talking to someone, especially a mental health professional. So if EAP is trying to capture that 20%, there are percentages of folks that may be getting help somewhere else. And it may not be the best help, right? It could be at the bar or it could be somewhere else. But so we're trying to capture as much as that we can. But certainly, Suzanne, I think a big piece of it is talking about it, making it comfortable, top down. So the higher up folks in your organization can talk about it and be comfortable. A great example, Russ Cox from Norton Healthcare on his weekly meeting talked about, hey, we have an EAP here, folks. This was a weekly meeting to his employees. I encourage you folks to check it out, to use it. It's a great resource. So top down type information, and it's a grind sometimes. It doesn't happen overnight, but the more you can make it a part of your culture, I think the more you can start to see that utilization go up.
I would also say,
oh, go ahead. Sorry, go ahead, Tony.
It's Suzanne. I'm so sorry. I just wanted to, what I'd hope to get out of this today, and forgive me, is that, we are a company of senior caregivers, and so our business has been hit really hard. And I'm sure, like other senior care companies here in Louisville, we've had an EAP for several years. It's always been underutilized. I don't know if you mentioned, and forgive me, my computer took about 20 minutes to boot this morning before I was able to get on the call, but the University of North Carolina had put together a care for caregivers site, and I don't know if that was mentioned, but we've tried to emulate that. And so what our site literally does, it shows emergency services, crisis hotlines first, and then it goes into our EAP and other things. And we just aren't seeing the traction on our EAP. We added a chaplain service because we have had employees and our senior residents that have died. And that seems to be getting way more traction than our EAP. And so at this point, we're wondering, is EAP a thing of the past? Should we be buying into more programs like Talkspace and things like that to use for EAP? So, I mean, I don't know if you could give your thoughts on that.
Well, I can tell you, I don't think EAPs are a thing of the past. I mean, we kind of touched on that in the beginning. Certainly, we're an EAP company, so that that's going to be my opinion. It really is. It's a combination of folks, and it sounds like you're doing this, carrying the flag at your organization and talking about EAP, engaging your EAP to be a part. Whether that's right now, we're doing Zoom meetings with our folks, talking to your supervisors, doing trainings, doing refreshers, anything we can do, having that kind of personal connection into the EAP rather than just being a phone number on the wall. So, yeah, I don't know, Tony. Yeah, go ahead. I'll see you.
I do. Want to get some perspective. Derek, it may not be exactly correct, but I think we've got companies that have utilization of 10%. So 10% of their company employees are coming in and using our services. So it is being used. And we've got, I think the lowest is maybe 5%, 4%. So it whacks and wanes. Not everyone's 10, but it's being used. So I would think, and answer your question, see if the EAP would be willing to come on site to see, and be present for a couple hours. Broadcast that out that they're going to be there. I'm wondering if the chaplains are being used because maybe there's easier access. So how do you open up the access to the EAP for the employees, have them on site? I cautiously say, without knowing this, when I hear that you've listed a lot of resource numbers and then the EAP, it makes me think that maybe it's diverting them away from the EAP because they're going to the resource numbers first. Now, I understand.
Well, EAP is up near the top right after the crisis hotlines. I mean, because that's what we wanted people to hit when we've got suicide and all sorts of. But remember, we're senior care, so we can't have somebody from the EAP come in. And yeah, and so I guess, have you guys, our EAP added BetterHelp, which is a digital therapy program that's, contracted in. Are you finding that people are using the virtual one-to-one therapy sessions with a local provider, or
Yes.
are they more interested in using somebody like in a mobile app that they can use anytime, anywhere?
No, we're therapists that are local, and we're seeing all of our people through Zoom, and it's going incredibly well. So our utilization is going up. So yes, they're interested in the Zoom. They're also interested in the relationship. What I mean by that is, I may see somebody, they get 6 sessions per year. So I see somebody and we form a relationship and we help them out with their family. And then next year they come back and they want to see me again, and we continue on with some of the other issues. And likewise, other therapists form relationships with their employees as well. Along with this, and it's really important for the EAP, for you all as the company, is because I'm seeing the majority of the company's employees, I get a pulse on what's going on inside the company. So I may pick up trends that are going on, and then in our quarterly reviews, we sit down and we share that information with the company, and they find it really helpful. So if you've got a talk space, every time your employee calls, they're talking to a different therapist. They may have a hard time getting back to some therapist they saw last year, along with the fact that all your kind of core information about what's going on inside your company is getting disseminated over all kinds of different therapists that are never going to be able to find a narrative. You're not going to be able to get a narrative report back about this is what the feel of what we're picking up of what's going on in your company. So I think having a core EAP is critical for a company. I think there's a lot of benefit.
Wait,
I was
maybe.
going to add before, one, Susan, I would say, or Suzanne, sorry. I mean, obviously, you all get kudos for communicating the things that you're communicating. I think that what I was going to say before is that's kind of been the biggest issue we've seen in clients. So EAPs typically, so there's a company like Wayne Corp, that's what they do. People go in and install that. A lot of times EAP is just sort of a part of, it's an add-on into the ancillary non-medical benefits, and it really is a total add-on. Like, it's never even mentioned anytime, anywhere. That's been the past. We are hearing a lot from our clients, and again, same thing as they've just described, is a lot more communication. Hey, we want people to know about it. We want post it more. It's not just something on the wall. So, I give you kudos for providing all that information. That's really probably the best thing you can do, is give people options to consider. And the more that we communicate this and people realize that it is easy, and that it's private, they will hopefully take advantage.
Another quick thought I mentioned, it's a senior living situation, so that you can't have a therapist on site. We work with major hospitals, and we create a Zoom room. The Zoom room is that it's kind of open. It's open. So if an employee is having a hard time, they need to come in and talk to the therapist, they can come in, and the therapist is available, and they can talk with them. So even though you might not be able to have a therapist on site, you could create a Zoom room where they're technically on site, so on demand, if you will.
I see on your site that you've got a list of providers. We are across really nationwide with 16,000 employees. So do you work with businesses that large? We have Magellan EAP, which I know is a huge EAP.
Right, kind of the Walmart, the big box, yeah. So the list of our providers are kind of our in-house account managers.
Okay.
So they're kind of overseeing a lot of the accounts, but we have a network that we've built ourselves, a private network of counselors, therapists across the entire country. So yes,
okay.
we're currently covering employees from here to California, and there's pockets, of course, so if we bring on a new company, let's say has a lot of employees in North Dakota, and we happen to not have developed the network there yet, then we can quickly develop that. It's not an issue. So.
Okay, thank you.
Great question. Thank you for the comments.
So anyone else, if you have questions, obviously we're using to some extent the chat, which is the upper right corner of your screen. But if you have other questions, feel free to unmute if you're muted and raise that question. We've got just a couple minutes before we close out. So is there anything else that while we have Derek and Tony on, we're live, we're doing the virtual conversation. So anything else that you want to ask or bring up? And I saw somebody post, hey, can you send out the slides? Yes, what we'll do is, again, I think with their permission, but we'll certainly have this recorded session is going to be in our website later today. So worksite wellness, what is it? Louisville worksitewellness.org. It'll be posted, and then probably have their slides on there as well as a PDF. So we will certainly share those.
Yeah, so it'll be recorded, and I'll send a copy of these slides over to Patrice and Alex and Matt, you guys, and feel free to do what you want with them.
Well, we'll post them on our site.
Yeah.
Again, probably later today they'll be there. I'm not sure what else we could do with them.
I don't know.
So again, anyone else? Again, your floor is yours if you want to step in. Well, I'll tell you what. I will just consider that they did Derek and Tony, great job in covering the topic and giving us some insight. Again, as I said at the outset, we're at the end of 2020, and I hope we're at the end of all that stress that came with it. But we really appreciate you all sharing your expertise and just sharing your insights about what's going on and what EAPs can do to address some of those issues within the workplace. So with that said, we will thank you all and thank everybody for joining this morning. Alex, let me let you jump in for a second. What's next month? We're skipping next month in terms of an actual conversation, is that right?
Yes, I think we're pausing for next month. So we'll have more details around all of that soon, and we can send that out via email. But yes, I think we are gonna have December as a little bit of a break for everyone. I know it's been quite a year.
So obviously starting in January, we'll be ramping back up again. We'll have third Thursday of every month. Probably going to be in this virtual setting as opposed to Milestone. But again, hope you all have a wonderful Thanksgiving and a great holiday and New Year. because we won't talk to you before then. So again, Derek, Tony, thank you so much. We appreciate
Thank
you all
you.
participating.
Thanks so much.
Matt,
Yes,
this is
ma'am.
Patrice. I would like to say something before everybody gets off. I'm sorry. But I just want to thank everyone for still participating in our monthly conversations. We appreciate each and every one of our speakers. We have had dynamic speakers this year. I want to give a kudos to Annetta Hunter, which was my co-chair for the last 2 years. And, she worked tirelessly with me on just bringing these types of conversations to our HR and our wellness professionals, and it's truly our mission is to bring you relevant topics, things that you can take back, if not for yourself, for your employees. So we just want to say thank you for just being faithful and sticking with us through this transition. We all are still trying to figure it out and get things, still moving forward, still remaining relevant, and it has not been easy. And so this actual presentation has been very good for me. I needed this myself. So I just want to say thank you. Thank you to all the board members for your patience. And I just really appreciate the council. So thank you to everyone.
Thank you, Patrice. We appreciate that. And again, we will sign off, and we'll look forward to seeing you at the third Thursday of January. Have a wonderful day and a great rest of the week. Take care.
Thanks so
Bye,
much.
everyone.